My name is Sasha. I'm a pediatric emergency medicine physician, and I'm also a father of 3 and a caregiver of one of my children who has epilepsy. And that's put me in a position to be both a caregiver and a physician in a healthcare system that has allowed me to really have a well-rounded perspective of the care journey. As a caregiver, as a father of a son with epilepsy, at the same time as being a physician, it was a very complicated observations that we were noting, and so it was very hard for me to communicate that to my care team. So my wife and I ended up figuring out a way to make it very visual with graphics, and that was a great communication tool because we came prepared, we came with a visual, and then we would talk around this document. And I've learned that when caregivers come prepared with some kind of document in whatever visual form they choose, it really helps drive the conversation in a collaborative manner. I've encountered many scenarios where I've observed families leave encounters frustrated. And when I explore those frustrations, it revolves around miscommunications or not feeling that we've heard or listened. And over the years, I've been involved in helping develop tools that ensure that people are empowered to speak up and bring what they've observed to the table. And I've also tried to facilitate that healthcare teams need to start listening and look at tools of how they can listen. I can understand how caregivers, when they arrive to their care providers, come in really nervous and worried. I've observed they don't want to waste our time. They don't want to look silly. They don't want to ask the wrong questions. And that often creates a scenario where we're not actually communicating effectively. Healthcare workers, we really want to know how we could help you, or the caregivers. And so it's okay to ask anything. And while I recognize a lot of times we can come off very intimidating, that's really not our goal and that's not our intentions. And I think sometimes just coming in and even stating I'm really nervous about the encounter will often set a tone for a much more productive conversation and collaboration. As a physician in my organization, I spend a lot of time thinking how we can optimize patient-family-centered care. What patient-family-centered care means to me is for physicians to recognize the value that both patients and their caregivers and the inputs that they bring to the table have. They're the ones living with their experience 99.9% of the time, and I as a physician need to learn about that experience. Together, if we achieve that patient-family-centered care, we're able to deliver better health outcomes and a better experience for both patients, their caregivers, as well as for the healthcare teams and the physicians. And that's what's most important, is that the health outcomes are optimized.